Welcome to the Surviving Cancer in Rural and Regional Australia information session. This is the first national program for all people living with cancer, their families and carers. We are broadcasting via satellite from here at Westmead in Sydney to 57 other rural and regional sites in Australia. Welcome and thank you for joining us. Hello, my name is Professor John Boyages. I'm the Director of the New South Wales Breast Cancer Institute here at Westmead. I'm a radiation oncologist and I will be the facilitator of today's program. There's no doubt that cancer is on the increase and is a disease that can affect people from all age groups and all walks of life. But there is no doubt in my mind that there is additional challenges and problems indeed for people living in rural and regional Australia. How hard it is to come to the big smoke for treatment. 30% of Australians living with cancer are indeed located outside of urban areas. About 15,000 people who live in regional areas will be newly diagnosed with cancer in the next 12 months. There is indeed a significant gap in the provision of readily accessible information for people living with cancer, their families and their carers who reside in regional, rural and remote Australia. This satellite information session has been planned to allow the experts to come to you to begin to address this gap. In Australia, by the age of 75, a cancer diagnosis is likely to affect 1 in 3 men and 1 in 4 women. Every day, another 250 people will be diagnosed with cancer. That's almost, a whole jumbo jet full of people diagnosed with cancer today. So you are certainly not alone, and there is much work being done to increase survival from cancer, particularly by the group of organisations that I'm about to show here. This information session has been developed by many organisations working in cancer care. It has been a great collaborative effort. This includes clinicians and allied health professionals, as well as patient advocacy groups and government representatives. The steering committee is made up of 20 main cancer charities and support organisations in Australia. It has been indeed a fantastic collaborative effort which has resulted in the excellent program we will be bringing you today. These organisations, along with their contact details, are listed on the back of your program. Many thanks to Roche Products for their extremely generous sponsorship of this event. Thanks also to the coordinators at each site who represent some of the organisations in the steering committee. The coordinators have played an essential part in distributing information about this symposium and ensuring everything at your venue was ready for today. And thank you for those coordinators. We have an excellent lineup of speakers from around Australia. These experts will provide you with the latest findings and practical information to assist the survival of cancer. Kate White, firstly, will be talking about dealing with issues of isolation, intimacy, and other personal issues, along with ways to seek support. Kim Hobbs will be discussing dealing with and changing family and social dynamics, and will provide practical advice about employment, superannuation and insurance issues. Robert Newton will outline the role and benefits of physical therapy and exercise, physical activity and exercise during, post-treatment and ongoing. Craig Hassard will be talking with us about traditional and complementary nutritional management, and you will also hear a personal journey of surviving cancer by South Australian newsreader Graham Goodings. Louise Gilmore will talk to us about a carer's perspective and ways to gain support for the carer and family members. After a 15-minute break, the final session of the day will be a question and answer session in which these experts will then be on hand to answer your questions. A little bit of housekeeping. At the end of each talk, write your question on the form provided and pass it to the end of your row or to your coordinator at your venue, and that will be faxed to us or telephoned through to us. Your coordinator will be sending these questions through here to Westmead on the telephone number and fax number shown. Questions, of course, about your individual situation cannot be answered. Obviously, that takes a 30 to 60-minute consultation with a doctor, but we will be talking about the principles of care if we can and support. If your question is not answered, please refer to the back of your program for further information contacts. There are 58 sites around Australia receiving information via satellite, which is an impressive national reach. It's been a great effort by the coordinating committee. I would like to welcome all those across New South Wales and the ACT here with us today. We've got many sites listed there. I won't go through them all, and I'm hoping some of these rural locations are getting a bit of rain today. In Queensland, we've got the following locations. Welcome to Queensland. Hello and welcome to our participants from Victoria and Tasmania. And finally, welcome to all those in South Australia and the Northern Territory. Due to the time zone differences, Western Australia is joining us this afternoon via delayed satellite broadcast. A special welcome to Western Australia later. Before I introduce our first speaker today, can I please remind everybody across the country to turn off your mobile phone. Our first speaker is Associate Professor Kate White. She is the Director of Research Support at the Faculty of Nursing at Sydney University. Kate has experience in research and teaching and is an expert in palliative care. The focus of Kate's work includes psychosocial issues and quality of life for cancer patients and their families. She is often involved in rural clinical and research activities. Kate's topic today is emotional, social and personal issues of living with cancer, a very important topic. Kate will be dealing with such issues as isolation, intimacy, sexuality, and she will provide practical ways for patients, for people with cancer, to gain support. Please welcome Kate.